Hello everyone, welcome back to my channel. I'm Amin Ibrahimi, a physical therapist, and today we're diving into a crucial topic, meniscus injuries and how physical therapy can help with recovery. The meniscus is an essential structure in the knee that provides cushioning and stability. Unfortunately, it's also one of the most commonly injured parts of the knee, especially among athletes and older adults. If you've ever experienced knee pain, clicking, or feeling like your knee is locking up, you might have a meniscus injury. So in this video we'll cover what the meniscus is and why it's important, how meniscus injuries happen and their symptoms, treatment options including physical therapy exercises, and how to prevent future meniscus injuries. Let's get started. Meniscus anatomy and function. The knee joint is made up of three bones: the femur or thigh bone, tibia or shin bone, and patella or kneecap. Between the femur and tibia, we have two C-shaped pieces of cartilage called the menisci, one on the inner side or medial meniscus and one on the outer side or lateral meniscus. The menisci act like shock absorbers, distributing weight across the knee joint and preventing excessive friction. They also help us stabilize the knee during movement. Causes and risk factors of meniscus tears. Meniscus injuries typically occur in two ways. Acute injuries. These happen suddenly due to a twisting motion, pivoting, or a sudden stop, common in sports like basketball, soccer, and football. Degenerative tears. These develop over time due to aging and wear and tear. Older adults are more prone to these injuries because the meniscus weaken with age. Other risk factors include playing high-impact sports, poor knee stability or muscle imbalances, previous knee injuries, and osteoarthritis. Symptoms of a torn meniscus. A meniscus tears can present in different ways depending on the severity. Common symptoms include pain along the joint line of the knee, swelling and stiffness, a clicking or popping sensation when moving the knee feeling unstable or like it's going to give out, difficulty bending or fully straightening the knee. How meniscus tears are diagnosed. If you suspect a meniscus tear, a doctor will perform clinical tests like McMurray's test, rotating the knee to check for pain and clicking, Apley's test, applying pressure to the knee while rotating it. To confirm the diagnosis, an MRI scan is often used to assess the severity and location of the tear. Treatment options. 1. Conservative treatment, or non-surgical approach. Many meniscus injuries can heal without surgery. The first step is following the RICE protocol. Rest, avoid high-impact activities, ice, apply ice packs for 15 to 12 minutes several times a day to reduce swelling. Compression, use a knee brace or bandage to prevent excessive movement. Elevation, keep your leg elevated to reduce swelling. Pain can be managed with NSAIDs like ibuprofen or acetaminophen. 2. Surgical options. If conservative treatment doesn't work, surgery may be required. The main surgical options include meniscectomy or removing the damaged part of the meniscus repair, suturing the tear, allowing it to heal naturally only for certain types of tears. Meniscus transplant, rare but used for severe damage in younger patients. And now physical therapy and recovery. Here is a comprehensive exercise plan for meniscus injuries. Level 1 or earlier stage rehabilitation. Focus on mobility and pain reduction. The goal here is to reduce swelling, restore mobility, and prevent muscle atrophy. The exercises include heel slides, lie down and gently bend and straighten your knee. Quadriceps sets, tighten thigh muscles and hold for 5 to 10 seconds. Straight leg raises, lift your leg while keeping it straight. Seated knee extensions, slowly extend your knee while seated. Level 2, a strengthening phase, rebuilding muscle and stability. The goal here is to strengthen the knee and surrounding muscles. The exercises include clamshells, lie on your side, bend your knees, and lift the top knee. Mini squats, slowly squat down while holding onto a support. Step ups, step onto a low platform and back down. Wall sits, hold the seated position against the wall. Level 3, advanced functional training, preparing for daily activities and sports. The goal here is to improve dynamic movement and knee endurance. The exercises include lunges and step downs, single leg balance drills, stand on one leg for 20 seconds, switch sides, resistance band walks, side step with a resistance band around your knees, plyometrics, especially for athletes, light jumping drills to prepare for sport-specific movements, level 4, sport-specific training, for athletes returning to play. The goal here is to ensure full recovery and prevent future injuries. The exercises include agility drills, ladder drills, side shuffles, and cutting drills, sprinting progressions, short sprints at 50 to 100% intensity, pivot and cutting exercises, controlled movements to simulate sports activities, jump training, controlled landings to build knee resilience. That wraps up today's video on meniscus injuries and physical therapy. Here's a quick recap. The meniscus is a critical cartilage in the knee that absorbs shocks and stabilizes movements. Meniscus tears can occur due to sudden injury or wear and tear over time. Treatment options range from conservative management, rise and physical therapy, to surgery in severe cases. Physical therapy is key for recovery, focusing on mobility, strength, and stability exercises. Preventing future injuries is possible with proper training and knee care. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss a video. Comment below if you have any questions or share your experiences with knee injuries. Thanks for watching and see you in the next video.